Good morning, good evening. Thank you for being here today. We will start soon. I think there are a lot of people connected already. So thank you for participating in this webinar of navigating localization and equitable partnerships today. My name is Gabi Escudero, and I'm the director of D4I. This is our fourth webinar on focusing on localization of the MERL process. So monitoring, evaluation. Today we will talk about how we work from policy to practice, navigating localization and equitable partnerships in global health. We have three panelists, Rebecca Itsuachi, Thesson Katsini, Marta Silva, and Jana Wisniewski. This webinar will be presented in English and French with interpretation. You can click on the interpretation icon at the bottom of your screen and select the language you wish to hear. Click on French if you want to hear the French, and English if you want to hear the English. Regarding the subtitles, you can select display subtitles if you want to see them for the session. Select French if you want to see subtitles in French, or English if you want to see them in English. The webinar today will highlight collaboration between D4I and CEFA Group in the Amplify project, financed and funded by the International Agency for Development USAID. The webinar will represent an overview of the evaluation and results and reflections, and also a panel discussion on challenges and lessons learned to navigate in localization and equitable partnerships in global health. Let's talk about D4I now. It is funded by USAID. D4I is a consortium led by the University of North Carolina in Chapel Hill in partnership with Palladium, ICF, JSI, and Tulane University. D4I strengthens local capacity to generate and use high-quality health data for strategic decisions on health policy and programming at national, subnational, and community levels. D4I investigates program effectiveness, integrates gender into all activities, supports adaptive management, and learns from evidence. D4I draws on the technical expertise that exists in each partner organization and an extensive network of local partners in USAID's priority countries. Throughout the webinar today, you can ask questions using the QA function in Zoom, but please do not add questions to the chat. We will do our best to address all your questions at the end of the webinar. Localization and in monitoring, evaluation, research, and learning can ensure that local actors have resources and capacity necessary to make equitable decisions and based on evidence. The implementation of these principles in activity of monitoring, evaluation, research, and learning include strengthening local capacities, using a systems lens, engaging with diverse local actors and organizations, and implementing other good practices for local-led development. As I said, today is our fourth webinar on localizing monitoring, evaluation, research, and learning. These series will share tools and approaches for an efficient planning of actions in terms of capacity, and we will also mention the follow-up, the monitoring of sustainability, and also local actors in complex system. We will also mention promotion of local voices through social responsibility and other aspects. The next webinar will happen on the 17th of July and will highlight point of view from insights from local actors in Burundi, Colombia, and Malawi on localizing monitoring, evaluation, research, and learning. We hope that you will be able to join for this webinar. Now I would like to present the moderator for today, Marta Silva. Martha co-led the project evaluation. She is a deputy professor at D4I at the Public Health School of Tulane University. She has over 20 years of experience in research and monitoring in global health I will now give the floor to Martha. Thank you, Gabby. Is a sociologist with a lot of experience in a social research experience in Central Africa. He is the executive director of CIRA Group in Togo. He was the leader of a mission in CIRA Group, evaluation of quality of the project data for impact in Côte d'Ivoire and Togo. Miss Rebecca is what she is, a sociologist and researcher in quality for the CIRA Group in training research in Côte d'Ivoire. She has expertise on sexual and reproductive health and population policies applied to health. Her work contributed to the creation of reference documents at a national level. She has a lot of experience in the training of new generation quality researchers in Côte d'Ivoire. She has also implemented the Amplify PF project in Côte d'Ivoire. Rebecca, I'm going to start with you. The first question that I wanted to ask you is, what are, according to you, the main challenges to measure localization in public health programs? Thank you, Rebecca. Thank you, Martha. I think, in my opinion, and my experience with D4I and other partners, that the main difficulty was to take the local context into account. Here in Côte d'Ivoire, we have a lot of population categories, ethnical communities, and the values, the living conditions, the needs are different, and measure something that is perceived differently in different contexts, in different communities is very difficult, complicated. That's why I think when taking into account this measurement, we cannot have a standard. We need to put the emphasis on the definition of what we expect from this measurement, and that we need to adapt to each specificity and specific community. That was a main challenge for me. Thank you, Rebecca. Sefson, I'm going to continue with you. Same question. So what do you see as the main challenges in measuring localization in public health programs? Thank you, Martha. So I think, as Rebecca said, I would place the challenge on 3 levels. First, on the output level, the outcome level, and the effect level, what we expect from the localization. So with regard to this, it is really essential to know the indicators accepted at each level of measurement. They need to be accepted, they need to be clear, accepted by all, and that's why when we had our activities that were led consistently with what was accepted as log frame, because as we saw in the presentation, there was no localization concept in the project, the Amplify project that we evaluated. So that made the work complicated, and that's why the funder asked to measure this. But also, one of the challenges of the measurement of localization can be not only on the implementing side, but on the side of the organization, so the partner organization. So if it is clearly defined at his level, we can measure from the implementing side and the partner side. So the localization concept can be evaluated on both sides, and we will have a consolidated data for 2 measurements of localization. So this is what I wanted to share. Thank you.
Yeah, I have a few things to add. And I would mention that I think I'm going to be speaking generally and not necessarily about the Amplify project specifically. But I think in general, I've found that there is not, and I think Sefson alluded to this, there's not always a clear understanding or the same understanding of what localization even is. So some people just off the top of their head think that localization is just maybe incorporating some local perspectives, and that's it, when it goes much, much deeper. And so this can make it difficult to capture data. As I said, if people don't have the same understanding as you of what localization is, it makes the data collection and analysis more challenging. I would also say that measuring localization presupposes that localization is the goal. And in some projects, we've had informants who are not convinced that health projects should be emphasizing localization. And so this can make it challenging to measure as well. interview can become more of a debate than an interview on people's thoughts about localization in global health. And then I would say lastly, in some settings, projects are really working on the preconditions of true localization. So doing some capacity strengthening or other activities that are laying the groundwork for true localization. And if you don't design your research questions in the right way, you can miss that. And you can say nothing is happening with localization when really some good things are happening. We're just not at the level of true systematic localization. So that's what I would say.
Rebecca, we'll start with you. Question 2. From your perspective, how have research partnerships evolved over the last decade? Thank you, Martha. In my view, well, I am very positive. I think that it has changed, it has evolved very positively. From my point of view, the partnerships have become more global, more interconnected, and above all, impact focused. At the beginning of my career, I saw people with research more based on the results, but now it's more about the projects as such. And here, when I refer to partnerships that are more global, more interconnected, it's about, for instance, collaborations with research institutes, with, for instance, American and European research institutes, with some countries in Africa and Côte d'Ivoire. This is more frequent than before. And this is not only limited to university structures, to academia sector. It goes beyond that, even to the research offices. For instance, that we can see a research project, French or American, in Côte d'Ivoire to lead a research activity in order to be also supported by experts, local experts who know what's the reality here, the local reality, in order to have more relevant, more accurate results and outcomes. I remember a few years ago, it was like, I'm giving you my protocol and you will implement my protocol. It was more like that in the past, but now more and more, when there's a research project, well, the structures here, the consultants here, the local consultants are consulted right from the onset, even before the protocol is drafted, where we are consulted to take into account, for instance, all the practical, the local aspects. And this is what I call friction of the minds, so we can produce something that is totally adapted, is really adapted to the reality, with all the different expertise and outputs and contributions. So I think that things have drastically improved with the competencies that are enhanced, that are put forward. We have expertises from Europe and from the American region, especially when it comes to methodology and so on. And therefore, things are, in my view, improving significantly. Thank you. That's all. Thank you, Rebecca. Son, you have the floor. Well, thank you. Well, I can say that things are more mitigated. This also depends on the commitment, the will from the partners to work when it comes to the capacity building of the partner organizations. And therefore, from a general point of view, I'll say that there is no change. This is why I said earlier that this is so-so. When it comes to, well, on a more philosophical manner, it is in this generality that one finds exceptions. It's in the mainstreams that exceptions can be found with, for instance, partners that would swim against the tide, so to speak. And this is precisely what provokes astonishment. There are some who would do things differently from what the majority would do. And this is why I'd say that change is quite timid, if I may say so. There's some what I'd call shy evolution.
I would echo a lot of what Rebecca and Sesson were saying. I think there has been more of an expectation that the prime involve the subcontractors in research design, analysis, presentation, and not just data collection. I think we are starting to realize that we were leaving a lot on the table in terms of their perspective and expertise, and that our research, it sounds simple to say, but our research is better, much, much, much better if they're involved the entire time. I think as the focus on more equitable partnerships has increased, the local partners have gotten more and better experience and maybe more financial stability as well. So they're able to reinvest in their own skills. And so each time we have one of these partnerships, the local partner brings even more. They've gotten that rich experience, and it's better for everyone, especially the technical aspects of the work. And then on our side in the US, we have come, especially at my university, we've come to view these types of partnership as a skill that we need to teach our students and our colleagues. And so we're trying to institutionalize how to work in equitable partnerships into our curriculum, into training for faculty and as well, and in the D4I consortium too. This is not something that we can continue to be weak at going forward if we're going to be successful in international research.
So, Rebecca, third question. What are the most important lessons that you've learned from establishing equitable partnerships with Northern donors and organizations? Rebecca, are you with us? Maybe Rebecca has some technical problems. Maybe son, we can proceed with you here. Sorry, Rebecca says. Sorry, can you repeat the question, please? Yes, question number 3. What are the most important lessons that you've learned from building equitable partnerships with donors and organizations in the North? Well, I'd say that the key lesson, I'd say that we were better and the result is more significant when we're all active and involved into the process. Well, why am I saying that? Well, because, for instance, as for the activity we had with the D41, BR and so on, well, in this case, the communication was really transparent, and that has allowed us to be fixed right from the onset on the objectives, the expectations with regards to the mission, and also on the intensity of the collaboration. We know what to expect right from the beginning. We know what is where it goes and what the work will be like. So we know what it's going to be about, and we can start working. We can start doing things. Second, it's about the mutual respect. I call it a mutual respect because this is what I felt. Mutual respect when it comes to my competencies, to my skills. Mutual respect for my competencies, for my skills, for my experience, for my knowledge. This aims at galvanize all of us, stimulate all of us, so we can be truly involved. An example, a case, I think it was back in 2014 or 2015, when I had my first true consultation, where I was at a national level, and there was an expert that I loved, that I really appreciated, Stéphane Maral, who had come for the presentation of the project. And when he arrived during the presentation of the project, I was asked a question, and therefore I transferred the question to someone else. And actually, he talked to me and he said, well, you are the expert here. And this question that you transferred to another lady, she wasn't able to answer this question because she was not as expert as you. And what he said gave me a lot of confidence. And this is what relaunched my career, because then I become aware, I realized that at that moment, that I was an expert on what I was doing, especially in the context in which we were. And that's why I'm saying mutual respect for my knowledge, for my competencies, for the local team. And therefore, given this respect, this mutual respect, we go beyond our capacities. Because again, this expression, this friction of minds with those methodology holders and the actors of localization, with all these skills, this enables us to have innovating results, quite high level results, because we know that the voice of each of us counts. Third, the benefit sharing, and as far as that is concerned, it's especially with the D4I and BR, We've also been able to benefit from the notoriety generated by these research projects. With USAID, we're going to mention the name of the expert from the northern part of the world, but in the collaboration that we had with D4I, we've seen that over all the process, and this is still confirmed today, the sharing of the benefits makes it even more, we would feel more confident. We also share the benefits, and this is the true lesson learned, because all the hard work you've made, you've done, your involvement, all your efforts into this activity, well, you can indeed share the benefits with those who were the origin of it. And I'm saying that just to let you know that we would work better, we have better results when each of us are 100% involved. And this depends on these elements: transparent communication right from the beginning, mutual respect of one another's experience and knowledge, and also the sharing of benefits. Thank you. Thank you, Rebecca. Citizen, a lesson learned, please? Yes, thank you. As for the lesson learned, I'd say that there are twofold, but it's not going to be too far from what Rebecca said. The first is that there are indeed organizations that are really concerned, that have at the bottom of their heart the fairness of the partnership relationships. But on the other hand, other organizations don't have that in their objectives, amongst their objectives. And for these organizations, it's always top-down based. And the local partners must accept to be left behind, to be put aside, and to be only on the field actors. But the example that my colleagues just mentioned means a lot, tells a lot, because it is in the very relationship with breakthrough research, DBR and D4I, that we felt indeed that there's another echo. Why so? Well, because with all our years of experience and also with humility, we thought that this was the rule. But when breakthrough research and D4I came up, things were different. We had the feeling we were on another planet, so to speak, and we thought, well, what's this kind of doing things? What is this this other way of working? And this is where the other lesson I'm drawing another lesson, namely the fact that the decolorization of research relationships is indeed possible because we're experimenting with it. The first time we saw our local actors on research presentation, the name of a local person, on a document with the donors, well, we were surprised. We thought that it was an error. And we thought that because this was not a standard, our logo on the document submitted to the donor or with the donors and in the final report. We thought that this was a mistake, but actually we were told, well, no, your logo should be there. And based on this collaboration, we thought, well, wow. We are indeed on another planet. Things are very different. So the decolonization of research relationships is really, truly possible. Thank you, Setson. Thank you. It's very kind of you to thank you for these kind words, but it's also sad that you are highlighting these results with breakthrough research and D4I.
Sorry, the translation cut out. You're coming over to me, right, for this question? Okay, sorry about that. My most important lessons learned. First, I think it's important to be realistic about building equitable partnerships. There will be, in a donor prime sub relationship, there are power differentials. There's nothing you can do about that. But I think where we can make a difference is in the interrelationships within the research team and the mutual respect that we have for each other's contributions. I have learned that working together is more work and takes longer. It's an investment in the quality of your product that you have to make. And you not only have to convince your own teams to put in that investment, but you have to have the support of whoever's funding you to put in that investment as well. And they might have different priorities in terms of the time, the money, the time and the money that they want to put into getting their results. So that's one. I think we've also found, especially in our relationship with Sarah Group, that this kind of thing works best when you have long multi-project collaborations because you can get to know each other better. You learn from each other, you learn each other's strengths and weaknesses and working styles and everything. It's just easier. And so sometimes that requires doing some maintenance of that relationship in between funded projects to keep that up, keep that strong. So when funding does come through, you're still kind of married in that way. And in that vein, I think that it's also important to be realistic about the first time you work with a new partner. It might be rough. It might not be your best dissemination meeting. You'll run into challenges, and that's okay because you are making this investment in a long-term relationship that in the end will produce better results. That's all I have. Thank you. I think you should take it. Yeah, Setsun, please go ahead if you have thoughts.
Yes, I can indeed answer this question. Actually, we can answer this in saying that, for instance, first, this comes from the commitment, the institutional commitment. In other words, at an institutional level, there should be a goodwill, the will to go in this direction. Maybe the institution don't see this necessity, these requirements, and therefore such forums, such webinars put the information, make this information available to also say that another kind of collaboration is possible. And the way things are done before and taking into account the local partners as people who implement things, this won't facilitate good collaboration with the local actors over time. So first of a commitment, an institutional decision making in order to go in this direction. Sometimes we would hear that it's not part of our policies to work with the local actors and to put them forward, to enhance them. But indeed, there should be a change in the policies, in the paradigms at the institutional level to define what is the vision in health, public health. Do we want to implement a project and go, or implement a project and also in the long term to seek the means to enable proper collaboration at an internal level, at a local level that would be strengthened, enhancing what we do all together. Thank you. I'm now trying to find the last question. Martha, Rebecca.
Rebecca has her hand up.
No problem, Martha. Just would like to add on what Setsun said. Indeed, there's a saying here saying that the foreigner has big eyes but can't see anything. Actually, when it comes to ethical, to fair collaboration, it's not only to enhance, to put forward the local actors, but also to shed the light on the relevance of the results related to the research activity that we're implementing. If some people would say, well, the local people are here to implement to do what I tell them to do. Well, I make money from my consulting activities. If I told to do what I'm told to do, then this is not enough because the local person's vision over the project hasn't been taken into account. This means that if the local actor hasn't been able to contribute or to tropicalize what, as we say here, the project, then the fruits, the results are not going to be relevant. It's as if a fund would be wasted in not doing things properly. As an individual, as a local individual, I can implement your protocol and let you go. But in this case, the community would not benefit from this situation, and you would lose your funds because the information, the actual information wouldn't take into account, the local context wouldn't be taken into account. But we know what's the reality on the field, and in taking into account our insight, because we have a good command of the different local things here. The result of the project won't be optimal. Thank you. Thank you, Rebecca. Indeed, this conversation is extremely important. It's key. And at least I hope that we'll have the opportunity to continue this conversation